Question number 1. While assessing a patient with Parkinson's disease, you note the patient arms slightly jerk as you passively move them towards the patient's body. Which of the following characteristic is present in this condition? Options: Option A, lead pipe rigidity, B, pronate rigidity, C, flexor rigidity, and D, cogwheel rigidity. So here the right answer is option D, cogwheel rigidity. It occurs when the arms are passively moved, which will cause them to jerk slightly. Question number 2. A 7-month-old infant seen in the emergency department suffering from episodes of severe abdominal pain, and the infant's stool become like red jelly. Abdominal examination revealed palpable sausage-shaped mass in the right upper cataract. Which of the following is the first line of therapeutic management of this infant? Options: Option A, non-surgical hydrostatic reduction, B, surgical symbol reduction, C, pyloromyotomy, and D, endorectal pull-through. So here the right answer is option A, non-surgical hydrostatic reduction. So this is the first line therapeutic management for intussusception is usually non-surgical hydrostatic reduction, which involves using contrast enema or air enema under fluoroscopy or ultrasound guidance to push the telescoped bowel back into the normal position. So therefore, the correct answer is option A. Question number 3. Your patient is 48 hours post-delivery. While assessing the fundal height, you would expect the fundal height to be options: Option A, 1 cm above the umbilicus, B, 2 cm below the umbilicus, and C, 2 cm above the umbilicus, D, 1 cm below the umbilicus. So here the right answer is option B, 2 cm below the umbilicus. So the fundal height will be decreased by 1 cm per day below the umbilicus. So therefore, if the woman is 48 hours postpartum, the fundal height will be 2 cm below the umbilicus is present. Question number 4. A client presents with blistering wounds caused from an unknown chemical agent. How should the nurse intervene? Options: Option A, do nothing until the chemical agent is identified. B, irrigate the wounds with water. C, wash the wounds with soap and water. Apply a barrier cream. D, insert a 20 gauge intravenous catheter and infuse normal saline solution at 150 ml per hour. So here the right answer is option B, irrigate the wounds with water. So this helps to remove any remaining chemical agents from the skin, which can prevent further damage and reduce the risk of complications. Identifying the chemical agent is important, but initial treatment should focus on removing the chemical from the skin to minimize its effect. Question number 5. An infant is born with spina bifida. Which of the following complications is always found in these infants? Options: Option A, hydrocephalus, B, craniosynostosis, C, meningitis, and D, cerebral palsy. So here the right answer is option A, hydrocephalus. So in spina bifida, that is a neural tube defect that can lead to varying degrees of neurological and physical impairments. One of the most common complications associated with spina bifida is hydrocephalus, which occurs due to the accumulation of cerebrospinal fluid in the brain's ventricles. This complication arises because of the disruption in the flow of cerebrospinal fluid caused by the neural tube defect. Question number 6. What is the most serious complications of a ruptured fallopian tube in ectopic pregnancy? Options: Option A, abdominal pain, B, pain and nauseated, C, peritoneal infections, and D, intraperitoneal hemorrhage. So here the right answer is option D, intraperitoneal hemorrhage. When a fallopian tube ruptures in an ectopic pregnancy, it can cause significant internal bleeding into the abdominal cavity, leading to intraperitoneal hemorrhage. This is a life-threatening complication that requires immediately medical intervention to control the bleeding and stabilize the patient symptoms. So the symptoms that may include severe abdominal pain, lightheadedness, fainting, and signs of shock. So prompt recognition and treatment are essential to prevent further complications and ensure the patient's safety. Question number 7. Which laboratory finding is the primary diagnostic indicator of pancreatitis? So options: Option A, elevated blood urea nitrogen, B. Elevated serum lipase, C. Elevated aspartate aminotransferase, and D. Increased lactate dehydrogenase. So here the right answer is option B. Elevated serum lipase. So elevated serum lipase is the primary laboratory finding used for diagnosis of pancreatitis. Lipase is an enzyme released by the pancreas, and elevated levels in the blood indicate pancreatic inflammation or injury, which are characteristics of pancreatitis. Question number 8. While planning for discharge education for a mother or a child with rickets, the nurse knows to include the need for adequate vitamin D. Which food should the mother choose for her child? Options: Option A. Potato and squash, B. Orange and tomatoes, C. Egg yolk and fish, and D. Milk and yogurt. So here the right answer is option C. Egg yolk and fish. So egg yolk and fatty fish such as salmon, mackerel and tuna are natural food sources rich in vitamin D. Incorporating these into the child's diet can help to ensure adequate intake of vitamin D. Question number 9. A newly appointed nurse director reviewed each staff nurse's resume and performance evaluation. The following day, she transferred staff nurse to areas of their expertise. The nurse director is exhibiting which type of management? Options: Option A. Staffing, B. Scheduling, C. Evaluating, and D. Designating. So here the right answer is option A. Staffing. The nurse director's review of each staff nurse's resume and performance evaluation, followed by the transfer to areas of their expertise, aligns with the staffing function. The process ensures that the right personnel are assigned to the right roles based on their qualification, skills, and organizational needs. By strategically allocating staff to the areas where they can contribute effectively, the nurse director optimizes the nurse teams to performance effectively and enhance overall organizational success. Question number 10. A nurse is assigned to care for a patient with physical immobility due to right knee injury. The nurse is preparing to write a nursing diagnosis. What is a priority for nursing diagnosis? Options: Option A. Pain, B. Hygiene, C. Dehydration, and D. Skin integrity. So here the right answer is option D. Skin integrity. Skin integrity is paramount in patients with immobility to prevent pressure ulcers, which can lead to serious complications. Question number 11. Which type of study design provides the strongest evidence? Options: Option A. Qualitative study, B. Randomized controlled trial, C. Systemic review of descriptive studies, and D. Systemic review of correlational studies. So here the right answer is option B. Randomized controlled trial. So the randomized controlled trial are considered the gold standard for evaluating interventions as they minimize bias and establish cause and effect relationship between the intervention and outcomes, while qualitative studies, systemic review of descriptive studies, and systemic review of correlation studies offer valuable insights. The randomized controlled trials that are generally more robust in providing evidence for clinical decision making. Question number 12. A 70-year-old woman is admitted to the cardiac care unit with new onset of atrial fibrillation and is receiving intravenous diltiazem and heparin. What is the most likely nursing diagnosis? Options: Option A. High risk for infection, B. High risk for impaired gas exchange, C. High risk for decreased cardiac output, and D. High risk for disturbed sensory perception. So here the right answer is option C. High risk for decreased cardiac output. Atrial fibrillation can lead to decreased cardiac output due to ineffective pumping of the heart. Monitoring for signs of decreased cardiac output is essential in this condition. Question number 13. A patient is diagnosed with hereditary hemochromatosis. As a nurse, you know that which substance accumulation in patient body causing hemochromatosis. Options: Option A. Iron, B. Copper, C. Chromium, and D. iodine. So here the right answer is option A. Iron. In hemochromatosis, Patient have iron overload. Iron can accumulate in organs such as skin, liver, pancreas and heart, leading to health problems. Hereditary hemochromatosis is caused by a mutation in certain conditions.